Hi everyone, welcome back to my YouTube channel and today we are going to talk about alien hand syndrome. So let's start our topic with introduction. Alien hand syndrome is a rare neurological disorder in which one hand acts seemingly on its own without the person's conscious control. Hand may perform complex movement, interfere with voluntary actions of other hand or engage in behaviors that are socially inappropriate. Alien hand syndrome is usually caused by damage to specific areas of brain such as corpus callosum, frontal lobe or parietal lobe and is often associated with brain surgery, stroke, tumors or degenerative diseases. Despite being aware of the hand's action, the person cannot voluntarily control it, which can be distressing. Definition of alien hand syndrome. Alien hand syndrome is defined as neurological condition characterized by involuntary, purposeful movements of one hand in which the patient experiences the hand as a foreign or acting independently. This individual retains normal sensation and motor function in the affected limb but has impaired control over its movement. Causes and risk factors of alien hand syndrome. First, we will talk about its causes. Alien hand syndrome usually results from brain damage affecting regions responsible for voluntary motor control and interhemispheric coordination. It includes surgical damage, that is, by following removal of brain tumors, or corpus callosectomy, that is, split brain surgery for epilepsy. It can be because of stroke, especially involving the corpus callosum or frontal or parietal lobes. It can be because of neurodegenerative diseases like corticobasal degeneration and Alzheimer's disease. There may be traumatic brain injury and that can cause alien hand syndrome. Then we will talk about risk factors for alien hand syndrome. It has older age due to higher risk of stroke and degenerative diseases. History of neurosurgery, neurodegenerative disorders, and brain tumors can increase the risk factors or increase the risk for the alien hand syndrome. Types of alien hand syndrome. First is frontal variant. In that, lesion is in the medial frontal lobe, and symptoms include grasping objects involuntarily, groping, difficulty releasing objects. Second type is callosal variant, that in which the relation is in the corpus callosum, and symptoms include hand interfere with the other hand, intermanual conflict, and undoing actions of the unaffected hand can be happen. Third type of alien hand syndrome is posterior variant, in which lesion is in the parietal or occipital lobes, and symptoms include involuntary levitation or withdrawal movements like sensation that the hand does not belong to the patient. Signs and symptoms of alien hand syndrome. First are motor symptoms, that is unintentional reaching, grasping or manipulating objects. Second, there is interfering with the intended actions of the other hand. May happen. Repetitive or conflicting movements occur. Then there are sensory symptoms. First, there is feeling that the affected hand is foreign or belong to someone else. There is loss of sense of agency over movements. And third, there are psychological symptoms that include anxiety, frustration, or embarrassment due to lack of control. And also, there are social difficulties that are caused by unintended hand actions. Diagnosis of alien hand syndrome. First we do is clinical evaluation, that is detailed patient history is taken focusing on involuntary movements. There is observation of intramanual conflict or involuntary action is done. Second, we can do neurological examination, that is to assess motor function, coordination and reflexes, evaluate sense of agency and awareness of the movements. And third, we can do is neuroimaging, that include MRI or CT scan to detect brain lesion in the corpus callosum, frontal lobe or parietal lobes. It identifies underlying cause such as stroke, tumor or neurodegeneration. Treatment and management of alien hand syndrome. First is behavioral strategies, that is training the patient to use the affected hand purposefully and keeping the hand occupied with an object to prevent interfering movements. And mirror therapy to increase awareness is also done. Second, we can do physical therapy, that is exercise to improve motor control and coordination. Bilateral hand activities are done to reduce intramanual conflict. Third, we can do is occupational therapy, that is teaching adaptive strategies for daily activities, task modification to reduce frustration. And fourth, we can do is medication, that there are no specific drugs for alien hand syndrome, but medication may treat underlying conditions like stroke rehabilitation and neurodegenerative diseases. We can also do psychological support in treatment, that is counseling to manage anxiety, embarrassment, and social challenges. Complications of alien hand syndrome. It may cause interference with daily tasks such as eating, dressing, or writing, and there may be accidental injury due to uncontrolled movements. There is emotional distress, depression, or social withdrawal. Prognosis of alien hand syndrome. It depends on underlying cause. Some causes improve spontaneously, especially after stroke recovery. Persistent cause may occur in neurodegenerative conditions like corticobasal degeneration. Behavioral and occupational strategies help patients regain some functional control. Prevention strategies for alien hand syndrome. It cannot be prevented because idiopathic or degenerative causes are there. Early rehabilitation and occupational therapy, often stroke or brain surgery, may reduce severity. Awareness and support for patient and caregivers is required in this case. Conclusion of this lecture video. Alien hand syndrome is a rare and intriguing neurological disorder in which a person loses voluntary control over one hand, leading to involuntary purposeful movements. Although there is no specific cure, a combination of behavioral therapy, physical and occupational therapy, and psychological support can help patients manage symptoms and maintain independence. And this was all about alien hand syndrome. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.